2. And we're live. I'm Tony.
And I'm Kristen.
And we're absolutely stubborn. I just realized my hair looked like a cockatoo.
Didn't you just get it cut?
Yeah, but it's just, my hair. Anyways.
Out of control.
Yeah.
So today...
My hair is absolutely stubborn.
Yeah.
But,
so is mine. Mine today, like the bangs keep just falling on my face. But anyways. So the big topic that everybody's talking about, I have been on social media and it's just that I feel like this is the only, besides politics, which I'm not going to get into, but it's either coronavirus or politics is all I see on the internet.
And they're basically the same thing now.
Oh my gosh, yes.
Actually, as it is right now, it's breaking news on Bloomberg. Trump, U.S. announces new guidelines to combat virus. So I don't know what it says. What they're saying right now because we have it muted, but but apparently, the world is going crazy.
Yeah, there's no toilet paper, no wipes for my baby. Thankfully, I have some wipes at home, but it's kind of annoying. If you don't have babies, don't buy wipes, guys. Limit your toilet paper. This is not an illness of the other end.
Well, so, I don't know. If it's the flu, don't you have a...
No?
No. You're a doctor?
No. But yeah, it's insane. There's people are going crazy in the grocery store too. But hey, business is booming for the grocery stores.
Yeah, that's for sure.
That's for sure. Kleenex, toilet paper, Amazon. Didn't you get a thing on Amazon saying that?
Yeah, it said that household items are out of stock at the moment. The good news is that I don't think, stores may be running out of food temporarily, but that chain, that whole industry there's no lack of food in the U.S. Thankfully.
I think they said they're running out of stock, but they're constantly.
Yeah, they're replenishing it.
Replenishing and stocking
it's fine.
Up. One of our grocery stores where we're at, we have a grocery store called Publix. They changed their hours to close at 8 p.m. so that it gives enough time for the employees to make sure everything's sanitized and to restock the shelves.
That doesn't kind of make sense to me because don't they do that anyways? Or do they literally sanitize
they're probably
shelves and everything?
Literally I don't think they're sanitizing all the boxes that people might touch, but they're probably sanitizing especially. I think they should do it anyways, but who knows? Like the conveyor belts and all that area that people are mostly touching. I know that Target, I had seen an article said that they were allowing their employers to work more time so that throughout the day,
wow, look at this.
Every hour, every 2 hours, they need to be cleaning the areas. So
breaking news, they're recommending avoiding eating out of restaurants. Can you imagine the damage that's going to do to the economy?
Well, you got a notice for one of the
avoid travel, restaurants, schools to fight virus.
So one of the things you got on one of our local restaurants was they're literally sending out an email saying we're delivering because it's just
it's which makes sense. It's restaurants are going to be suffering and not especially relatively new restaurants. They're gonna. They may have. I think they're like month to month. Think about it between rent, typical expenses, payroll. I would be surprised if I think most restaurants are month to month. I don't think they can go 60 days. It's just such a the markups aren't.
I don't know.
Unless it's I guess
not only that, but
any restaurant.
If they have a certain amount that they ordered for this month, I don't know how restaurants work, but if the food isn't going out, that's a lot of food that they're going to end up having to throw away too because it's not being sold. So
it affects everything.
Everything is suffering. Yeah, definitely. The only thing that is not suffering are the grocery stores, Target, Walmart, because I think people are going there to find toilet paper and stuff like that as well.
It's either pharmaceutical companies, biotech companies, companies that are coming up with the vaccines or potential vaccines, any kind of medical supply, mask, and that kind of thing. Those companies are going to be doing A-OK for now. And then once coronavirus kind of settles down, they're going to be like, stock is going to go to crap.
Change. But I mean,
restaurants are going to go, anything entertainment. Nobody wants, this may go for the next couple of weeks.
Movies, bowling, I don't know, different places that people, all the events that are in your local city are pretty much canceled. So there's not much to do but be in your yard, maybe. Go outdoors, they say. You can go outdoors, but, not anywhere, I guess.
I mean,
no,
you can go
schools.
outdoors.
I think all the schools are closed now.
Nationwide,
in the
I think.
States, yeah.
I think so.
So now all those parents who didn't like homeschool are being forced to homeschool. I know, like my nephews, they're a little older, so the teachers have virtual classes. I think they have to log in at a certain time to do their work. So teachers are still working, just not as long as normal school hours. Our son's only in VPK, so they just sent a few things, and our teacher's available with any questions. But yeah, we're having to homeschool.
Well,
I left it off to my mother-in-law today.
Should be interesting.
I gave her a few things to do with our oldest. But yeah, right now, at least for us, we're only told that this week we have off. Next week is our spring break, so that'll be the 14 days that you would have to quarantine yourself. But I don't know if they're going to start school right after, if it's going to be something that continues, I guess.
All right, so breaking news, everyone. NPR reports the White House Coronavirus Task Force issues new guidance: avoid gatherings of more than 10 people. I know homes that have like a house that has more than 10 people. This is like a movie. It really is like a movie. It's the kind of thing that would happen I would have never guessed that something like this would really happen. It's something so weird and so extreme that I never would have thought that we would have voluntarily quarantined, that we would have voluntarily, well, it's not even voluntarily in some cases. There's just so many things that are, like, schools are shut down, restrictions. So travel from Europe and back, and I think somewhere else, Canada is doing the same thing. There's a bunch of countries that are shutting down, basically.
Yeah, on one of the mom Facebook groups that I'm in, one lady in Spain says they're shut down. Like, they cannot leave their house. And they had an emergency with her husband, so they had to call the ambulance, and then he had to go to the hospital. But, like, you can't just, like, go to the hospital yourself. You cannot leave your house, apparently. I don't know if that's everywhere in Spain, but wherever she's at, apparently that's going on. I've been relatively calm about it, actually. I'm not freaking out or anything, but what scares me the most is when you hear places closing. That's the part, like, I don't think that it'll get to the point of grocery stores being closed, because people need to eat and get stuff. But that's a scary thought, because what do you do? What do you do if they close? You need to get food. I mean, there's only so much that the food's going to last in our house, And then I also see people writing about how all the meat and all the canned food is gone, but all the veggies and the fruits are still in the shelves, which is something that you need to eat. So I get both of those comments, because you should be eating your vegetables and your fruit, because that is what's going to boost your immune system. However, that is not going to last. I think people are thinking, if they close the grocery stores, I need to have food that's going to last. So that's why they're buying things that you can freeze and canned foods, which are not the best, but that's obviously what's going to last in your household if, God forbid, the grocery store is closed. So I kind of get both points.
So I'm going to switch the screen over here to get a better idea of what's going on right now. So there we go. So currently 181,380 people are confirmed infected, and I guarantee you that's easily 5 times the amount, because just the amount of people that get tested. I mean, I still don't know anyone that's gotten tested.
So somebody today posted, because they're feeling symptoms and are probably freaking out if they have the coronavirus, and they were asking, like, where do I get the testing? Do I call my doctor? Like, what's going on? And then somebody else commented that apparently their dad was really sick, and sent them back from the hospital. And now he was going back to the hospital again. So he possibly has it, but that there's not enough tests. Apparently, there's still not enough tests where you could just get tested to see if you have it. So that's why they're saying stay home for 14 days, treat it like a cold and flu, you know, and unless pretty much they're saying unless you're like dying, then you can go to the hospital and they'll test you. But that's absolutely crazy to me because they need to get more tests. If that's the case, they need to figure out how to get more tests.
It sounds easy. It sounds easy, but think about it. Something just came out I think this was in late November that it was in Wuhan, China, or whatever it was. So think about that. So that was late November. So Thanksgiving is when when this first started coming around.
It's been 4 months.
Correct, but that's when it first came out. So December started getting infected in that area, and I think we started hearing about it in December, but I know for sure January we started hearing about it. And then shortly after, it just obviously blew up because it spreads like a brand new virus. There's it's a brand new thing. It's like this crazy mutation that no body has ever seen before. Not a crazy mutation. This happens all the time. It's just this one's pretty bad. And I remember that XM. Did I mention that last time? There's an XM station that's just like, I think it's a sports medicine station or something like that. But whatever. The point is that it's all coronavirus all day. Wow. And they explained that it's very, 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 very rare for a virus to jump species to species. So like dog to human, pig to human, bird to human, and the other way around too, human to dogs. Like you can sneeze. I used to sneeze on hands all the time. Dog never had an issue. But this is that not only did it cross the species to species, but what they say is that it's also very difficult. Like I think SARS or MERS was one of those that crossed species to species, but for some reason it couldn't go human to human, which is weird, right? Like it's a hard thing to do. Well, it seems harder to do species to species, which some of those did, but human to human, not so much. It had trouble doing that. But this one is like the LeBron James of viruses, that not only did it do species to species, but it's doing human to human. So that kind of, it's just a lot of things going for that in a bad way for us. So anyways, going back to this report here, 181,000 people are confirmed infected, 7,122 confirmed dead. That sucks.
We should compare this to last week.
Yeah, well, I mean, it's going pretty good.
You guys can compare.
Yeah, I think it was at 100,000.
Yeah, just to see how fast
I think it was 100,000
within a week.
So 78,000 people have successfully recovered. That's pretty good.
Yeah.
Active cases 95,000. Monthly mortality. So it's gone up apparently to about 4%. So that's, it's pretty massive. Now this seems, the one good thing about this is that kids 8 or under, last I heard, no kids have died 8 and under. Right. 18 and under, very, very few. And it just progressively goes higher like that. So like 20 to 30, a little bit more, but very little. 30 to 40, I'm sure it's, it gets progressively worse as you get older, and with
60 and over is the most dangerous, especially if you have respiratory issues.
The good news is, look at this recovery rate. So, I mean, it's not phenomenal, but it's currently 43%.
But it's not, right. I think that, unfortunately, everybody hears about the deaths, all the people that have passed from it, and so that's all you're hearing. You're not hearing the recovery rate. There is a recovery rate out there, guys, so that gives hope, but it's obviously nothing to take away from the deaths, and it's definitely scary.
I still find it fishy that mainland China is
still
80, like last week I think it was like at 80,000, and they've only had another 1,000. So either they're doing an amazing job of locking everything down and quarantining, which kudos to them.
Maybe, because I think they're not allowed to like leave their home either, no?
I think so. I don't know the story, but that seems very low.
Yeah.
Or I don't know. I mean, considering how crazy this thing has gone.
Does it have here Miami? Does it show Miami?
Or in the U.S.? Let me see.
So 4,100 in the U.S. 72 deaths. Wow.
4,200 infected, 72 dead. It sucks. 60 people have recovered. Currently 4,000 cases are active. In the U.S., 1.72% mortality rate. And, well, so far 1.41. So currently, New York came out from way behind.
Like, yeah.
So Washington was leading that race that nobody wants to lead. So New York is now leading 954 cases there.
So we're
769 in Washington, California 473, Massachusetts 164, Florida 149. It just keeps getting like that. But really what matters is the deaths, I guess. So Washington's still up there in 42 cases, 6 in New York, 6 in California, 5 in Florida, Louisiana 2, New Jersey 2. So there's been a few deaths already in quite a few states.
Yeah, it's definitely scary. We just gotta try to stay, what is that word that they're using now? Socially, what is it?
Quarantined.
Quarantined. It's like
socially
a word
isolated.
Something like that.
So here's another, so if you haven't seen this, definitely see this because I think it was very valuable. There's a Joe Rogan experience with this gentleman called Michael Osterholm. Sorry for saying your name incorrectly. So he, I believe, let's see what he is. He is a Regents, is that how you say it? Regents professor, McKnight's Presidential Endowed Chair in Public Health. And he is an expert in infectious disease epidemiology. So this guy knows what he's talking about. And he is the director of the Center for Infectious Diseases and Policy, CIDRAP. The dude knows. He has a bunch of accolades. So, but definitely take a look at this podcast because it definitely will at least give you some more information. It'll explain just what a lot of people have doubts or don't really know what the heck is going on. This will give you a lot better perspective of what's going on, and it's pretty recent. It's only 6 days old. Came out March 10th. It's Joe Rogan episode 1439. Again, Michael Osterholm. Sorry, man.
I know, I'm horrible at
So, yeah. It's not good.
This is what it was called. It was called social distancing, is what they're saying to do. So it's a routine of avoiding crowds, public gatherings, or any place you closely or frequently encounter large groups of people.
That sounds like a weak. You know how they try to like make everything so weak? Like before it was PTSD, then it was actually no, before that it was shell shock, right? There's like a George Carlin thing on that where originally it was shell shock, but then people, according to George Carlin, people were like, so it's such a harsh word, so they soften words up. So quarantine, it sounds so now it's social distancing.
Maybe that's what it is. So yeah, it says public places.
Dude, you're quarantined.
Schools.
You're quarantined, that's it.
Shopping malls, sports stadiums, movie theaters, and outdoor events, which there are no outdoor events because I feel like everything's closed.
Social distancing.
Restaurants, bars, anywhere there's crowded places. So yeah, social distancing, AKA quarantine. My brother was making fun of me because Tony quarantined me this weekend when they went to go eat for breakfast.
I didn't quarantine anyone.
So he called me to see how I was doing on my quarantine.
Listen.
Honestly, I'm introverted. I love to be indoors, but the minute that I hear like quarantined and you have to be inside, I kind of felt a little restless. I'm like, shit, do I need to go to Target? Do I need anything? And I like being home. I don't even go out that often.
It's not a big deal for me.
Yeah, because you like being home too. This is like your dream come true. You're like, what?
I could be like
people?
I could be like Branch from Trolls and just have like my little bunker. And that'll be cool. Just as long as I have internet and power and and food, and I'm good. I don't need much. I got most of my entertainment online.
I do. I need to go out a little bit. What? I like being inside, but I need to go out a little bit. After a while, I get like cabin fever.
So wow, this thing is still going on. Yeah, so apparently, I don't know, we got to follow up on this Trump. It's not the Trump, it's the White House breaking news. They're having like this little thing. No, that guy's short, huh?
Yeah.
I think he's the Dr. Anthony Fauci. Perfect timing. He is the NIAID director. We're terrible at this.
Anyways, so that is the most recent as of what is today's date, March 16th. So if you're watching this, by the time we post it, those numbers definitely will change, but you can check out that website for any updates.
And I think that's pretty much it.
Yep. That's about it.
All right, everyone.
Wash your hands.
Wash your hands.
Stop buying toilet paper.
Social distance.
Social distance yourself.
Quarantine yourself. And that is it for today. Thank you so much. See you on the next one.
Wait. Oh. Please subscribe to our page and like this video if you like it.
And share it with somebody you think will enjoy a little coronavirus
info.
All right. Bye-bye.
Bye.